Okay, so this is hopefully, I think, the last section or session on the IRB application for DNP projects at New Mexico State University through the Maestro system. And so we've kind of made it through the project description here and subject information and all of the stuff that they're really interested in. So now we're going to go down and look at benefit and risk. And that is kind of, in the end, the meat of the IRB application. What is the potential benefit? Not just to patients or people who are being involved in this particular project, but you know, future patients, future staff, population as a whole. And so under the question 45, benefits to subjects, describe the potential benefit to be gained by the subjects as a result for being in this research study, or just say in being in this, participating in this project, or by others in terms of the results of this project, what we learn through the process. And so I wrote here on my application, potential benefits gained by subjects and other patients at this hospital include reduced risk of opioid addiction, not addition, addiction, or dependence, and improved functionality. And really we should say, I should say may include, because I'm not sure, may include, and possibly decreased length of stay resulting in reduced hospital costs. Again, I don't want to be, I want to, you know, I'm not 100% sure if anyone's going to benefit from this, but these are the potential benefits. And that's really what they're looking for, potential benefits. So think about that and think about what would your staff gain, increased knowledge about whatever you're doing. And kind of think about the outcomes and how that may translate into a benefit for staff or patients or the healthcare system or your community. So then down below here, there's a section on subjects. This is only for expedited review. So read carefully. If you are exempt, you are gonna just put, it says mark any yes, no questions as not applicable and skip the remainder of this section, okay? So this is only for expedited people. State whether the selection of subjects has been equitable. And you can say something very general, like, for example, all patients who meet the inclusion criteria will be invited to participate in this study. They want to make sure that you're not just targeting one small group who will benefit from this. You know, they want to make sure that you are being equitable. And then again, you know, when we talk about vulnerable populations, we don't want to exclude them just because we have to jump through a few more hoops in terms of IRB approval. So certainly doing work with children is important. Doing work with pregnant women is important, but they do require special protection. State the rationale for involvement of vulnerable subjects. So if you are using minors, economically and educationally disadvantaged, decisionally impaired, homeless, employees, and students, those are who the IRB is also a little concerned about. So here's what I wrote for mine, because this study does not focus on any particular or any one of these populations. It says here, I wrote, the study does not target vulnerable populations. However, it's possible that a potential subject falls within one of these following categories: economically and educationally disadvantaged, homeless, and employee at the particular facility. So I'm not going to have minors. They are excluded. We will not have individuals who have developmental delays or cognitive impairment as one of our exclusion criteria. Again, just for this particular, although it actually, and a lot of it is that is more for the survey acquisition, the collection of data via surveys. But it could be that someone, you know, who doesn't have a permanent home falls and breaks their hips, ends up in the hospital, and goes through this clinical pathway. We want to include them. Okay, so that's what I put there. Outline specific safety controls that will be required. Now, this particular project involves the implementation of a clinical pathway, and this is an interdisciplinary pathway. So there's a section for physicians and they write their prescriptions for postoperative pain medication. There is physical therapy, there is nursing care. So I said here, this clinical pathway is approved by the hospital administration and the chief physician on the particular rehab unit at this particular hospital. I will provide, I haven't done it now, but I'll provide information with the physician's name, contact information, their qualifications, their position. And so basically I'm saying, you know, there really is no need for additional safety controls because this is protocol. This is a protocol that's going to be applied across the unit. They want potential risks to the human subjects. I said there are no potential risks associated with this project since the clinical pathway will be implemented in all patients. And what I might change, I might say here, I will say there are no, I'm going to change this to say there are no increased risks associated with this project since the pathway will be implemented in all patients, and this therapy will be offered to all patients regardless of whether or not they're included in the study or project. If a patient enrolls in the study and has a negative outcome due to the clinical pathway or the therapy, then the hospital staff will follow their regular protocol, which includes notifying the patient's physician and determining an alternative course of treatment. Number 50, describe what measures or additional safeguards will be taken to minimize potential risks. And again, this should be a minimal risk study, so this may just be not applicable. Or to say there's a minimal risk study, there are no additional safeguards required. Okay. Describe, number 51, describe any protected health information, keeping in mind that even accidental disclosure of protected health information, that is a risk under the IRB. So if you are collecting protected health information, you know exactly what PHI is, then you need to have a plan for keeping it confidential and protected. So they want to know what kind of PHI, name, medical record number, date of birth, diagnosis. They want to know all the bits of data that you are going to be looking at if you are looking at patient data. Or, you know, if you're collecting information about the sex or gender of your staff, age range, stuff like that, technically that's PHI. Name, if you want to match data before and after your intervention, then you need name. It doesn't mean that you can't collect it. They just want to know what you're collecting. They're going to want to know that you're going to secure it. So I said here, no PHI will be viewed by the principal investigator, and that's me. The hospital staff on this project may have access to patient identifiers as part of their clinical administrative work at the hospital. But they're gonna, and I think I said down later that the IT staff is gonna de-identify it for me. And then down here, describe any protected student information. So that's about FERPA, and I said none because this is not a student study. And does this research require that you deceive human subjects? Some of the research I have done in the past with simulation, we deceived them in that we didn't tell them, nurses or students, that it was a study on medical errors. We disclosed it afterwards and we did a debriefing. But we were able to get permission to do this because we explained or were able to justify that that would change their behavior. None of you should be using deception, so that shouldn't be an issue. And then we finally get down here to informed consent. Now, if you are doing a survey where you do not need an individual's information, so you don't need to compare pre-intervention data to post-intervention data, so you can have an anonymous survey, you can do what's called an informational cover letter. And it's very much like a consent form, but it doesn't require that they sign. There are some studies where the data that we're collecting, it can be anonymous. Then in that case, the only risk to the subject may be disclosure of their name. And that would be a confidentiality privacy violation. So in that case, they allow us to do kind of a consent form, but without the signature. And so basically the informational cover letter, and there's information about how to do this on the IRB website, it'll have information about the study, what's involved, how long it's going to take, what it's about, who you are, all of your contact information, same, very similar to the consent form. But then at the end, it'll say, if you complete this survey, you are basically consenting to participate. And it could be an online, if it's an online survey, then you would copy and paste the informational cover letter into the first page on your survey if you're using SurveyMonkey or some kind of tool. If you are going to be recruiting individuals and you want to collect their PHI, especially if it's patients, you're going to have them do surveys, you're going to collect, you want their names so you can match them before and after, and you're going to have a lot of information about diagnosis and maybe hemoglobin A1C levels, individual. You're going to be mining the charts, and you're going to be pulling up, data, but it's not de-identified. Then, and you have individuals who you proactively are going to be recruiting to participate and then collecting data on, then you would need a signed consent form. So if you're going out and you're doing, an intervention in a community-based setting, and you're actually recruiting people to participate in and then fill in some, evaluation or survey data, then you will probably need a consent form. And there are examples of those. There's a template for that and on the IRB website. And again, if you're not sure whether you need a consent form or not, talk to your chair. And then if you're still not sure, come and talk to me or talk to the IRB. Lastly, I don't think many, if any, of you are going to compensate your people for your participants, so you probably don't need to fill this in. And then data use, what are you going to be doing? Well, if this was, I would say put thesis or dissertation, it doesn't really matter. Or down here, actually under other, you could put DNP project, other. I would put conference presentations if you're going to present the results to the employer or the school, and that would be, in terms of NMSU. Well, I guess that's actually a little bit more if you're doing school-based research. So conferences, presentations, DNP project, publication, journal article. It's not really a class project. If you're releasing results, if you're doing school-based research and you're releasing results to parents, then, then you put that one, results released to parents of subjects. Okay. And then this last section here is about confidentiality. You need to describe how you're going to keep this data confidential, even if it's de-identified. So I talked about de-identifying up here on number 63. I said prior to submitting the data to the PI, the hospital IT staff will de-identify the data so there's no patient identifier. So I'm not going to see anything. Only I'm going to just be able to see individual data lines so I can analyze them properly and make sure that we exclude people with missing data, but in the end, I can't identify who's who, anything like that. This format of the data, I said that we're going to have digital data, Excel and SPSS spreadsheets. If you have paper-based surveys, then you'd have to put paper surveys. Describe what security provisions. I said all data will be stored on an encrypted, password-protected computer. If you have data that is going to be printed, especially if it has PHI on it, and needs to be in a some kind of locked, secure filing cabinet or something like that. Describe where the data will be kept and for how long. It says federal regulations require data to be kept for a minimum of 3 years. And so I just put 3 years. And I said, will direct identifiers, names, social security numbers, addresses be recorded? If they are, put yes. If they're not, put no. And then, in a sense, for 68, 69, and 70, again, this is just, read it. If you're doing this, put, if you put yes, then you'd have to explain why you are using those identifiers and describe any kind of coding system you're going to use. And that's kind of 68 through 70. And then the last one is a checklist. So this is just making sure that you have everything that you are supposed to do. I would also recommend, so there is a checklist down below that we need to look at quickly. The approval team needs to be listed on your, up above. The certificates for everybody needs to be uploaded. And then they're going to want some supporting documents. If you're doing a survey, you need to attach a PDF of that survey. The consent form, they're going to want to look at your consent form. The permission from your organization. And those are kind of the key things. If you are going to do any kind of educational session, you can upload the content as well too. They usually don't care quite as much about that. They want more of the data collection instruments. And then lastly, don't ignore this last section here. Take a look through this and make sure that you have included this information somewhere in the proposal. Human subject, have you said how many people? Have you described how they'll be recruited? And you probably won't have to debrief anyone because you're probably not doing research that requires debriefing. So just read through this, and if you have any questions, again, please ask one of your committee members, or feel free to shoot me an email as well too. Then you're gonna click I hereby, I know everything's accurate. You're gonna finalize it. And keep in mind, if you're just working on this over time, you have to save it. There's some auto saves that happen, but always make sure you just click save. All right, well, I'm gonna end this video here. And if any of you have questions, feel free to reach out to me.